of State with responsibility for disability and older people, equality and mental health. But at this stage, Minister Roisín Shortall will address you.
Good morning, delegates. Our health and social care system is inequitable and often chaotic. As you know, access has been largely determined by a person's ability to pay. Most of the people have to pay fees to visit their family doctor. Those who can manage to pay the increasingly high private insurance premiums get faster access to treatment, even in public hospitals. We have lived through a private medicine boom. This was just as misguided as the property boom. Unplanned private hospitals mushroomed, while public hospitals struggled, and the most important part of the healthcare system, community and primary care, was generally neglected. At a time of cutbacks in public spending, we cannot continue with business as usual in Irish healthcare. Unless there is fundamental reform, there will be substantial cuts in services and the poor will be the hardest hit. That's why Kathleen Lynch and I have been concentrating on reform in the areas of primary and social care. Reform means driving down the cost of care. For example, increasingly, people put off visiting their GP because of cost, and often end up requiring more expensive hospital care. The programme for government commits to removing fees for GP care within this government's term. Reform also means changing the model of care so that it is delivered in the best setting by the most appropriate people. Most care should be delivered close to home by the healthcare professionals such as GPs, practice nurses, public health nurses, mental health nurses, counsellors, therapists and pharmacists who work locally. Social care too must move to this new model, in which care is delivered at the lowest level of complexity. The Fair Deal incentivises residential over community care. Reform is needed to ensure that older people needing long-term care are assisted in remaining in their own homes for as long as they wish. Resourcing community care, filling public health nurse vacancies, for instance, will enhance care in the community for older people and for children. New structures are being put in place within the health service to make healthcare funding more transparent and its administration more accountable on the path to universal health insurance. Although this is a very challenging time on many fronts, it is possible to emerge from this crisis with a reformed health and social care system, and that is our task. Delegates, I look forward to the debate. Thank you.